CIGTV News Brief, Community News and Weather Forecast, I'm Donna Bush. As the experts continue preparation plans for COVID-19 or the coronavirus coming to our shores, on Tuesday evening, members of the community were able to ask questions about the condition. Let's take a look back at some of the highlights.
You may have heard the phrase that is being used around this condition, which is to delay, contain, and mitigate. We in Cayman have been in the delay phase. We've been trying through protection at our borders, through some legislation, to slow the arrival of COVID onto our shores. But it is probably coming. It'll probably be here. It may be here already. So the next phase of this will be to contain it. And that's when you are all really responsible, and we really need your help there. Because if you are able to come forward if you have any symptoms, isolate yourself immediately, or if you know people that need to have that advice because you look after them in one way or another, or you can give them advice because they're your colleagues or friends, please encourage them to isolate themselves in order that we can stop the spread of COVID. Because what we really want to do is to slow the spread through the community so that we can stop it in some areas totally, and in other areas we can give everybody access to the care that they need should they need it. It is absolutely not the case that everybody is going to be desperately ill. Please be reassured by that. Up to 90% of people will have either a mild case, mild condition, or will not be affected at all. I need to tell you that for a doctor, mild means something a little bit different to a citizen. So when I say mild, I mean that you wouldn't have to go to hospital. So you may be in bed for a day or two, you may have a fever, like you have the flu, but you don't need to go and receive medical care. It's only that 10% that may struggle and may need additional care, and that's the 10% which we're trying to protect. The whole community needs to protect them to slow the rate of progression of this COVID through the community.
The symptoms from this virus are similar to the symptoms for any flu-like illness, but the most common symptoms are fever and a dry cough. Some patients, a very few, low percentage of them, around 10%, will go into more severe condition, respiratory distress, but the majority of these patients will have mild to moderate symptoms that don't really need admission. It's important also to know that symptoms like runny nose and sneezing without a fever are unlikely to be this coronavirus. We are in the process to acquiring the necessary reagent to start testing in the Cayman Island at the H.S.A. We have the equipment. We will start testing sometime next week. This reagent has been sent from the Pan American Health Organization to us, and we're expecting to receive those reagents by the end of this week and start testing next week. So that is important, because once we have any suspected cases, we will put the patient and the family on isolation. But by us being able to test here on the island and get a result between 24 to 48 hours, if those results are negative, then we are able to release this person for quarantine. As we all know, there is no vaccine, no approved vaccine yet for coronavirus. There are different companies around the world working in developing a vaccine, and a lot of resources have been put into developing a vaccine. But because a vaccine needs time to be completed, to be approved, to be tested, we don't anticipate an effective vaccine within the next 8 to 12 months. Treatment, there's no treatment. There's no effective treatment to kill the virus. However, the treatment will be symptomatic. So we treat your symptom. You have a fever, you receive treatment for a fever. If you have a cough, you receive treatment for a cough. You may need fluids, you may need oxygen, you may need other treatment that we will be able to provide. And as we know, not only the H.S.A., but the rest of the facilities in the Cayman Island were capable to provide this type of treatment.
There is a card that Border Control is helping us give out to every person that's coming into the Cayman Islands, and it's in English and Spanish, and it gives them the information that they need, that if they have those symptoms, that they can contact us, and the numbers are listed. Because we want people to tell us if they have the symptoms. We don't don't want persons to be, having the symptoms and trying to hide it because they're afraid of what we're going to do. We're going to send them back or whatever. We want to know if it's here so that we can contain it. When persons are quarantined or isolated, we expect those individuals to stay at home. I think that there's a misunderstanding in regards to what that means. When you're isolated, it means to some people that you stay at home from work, but you can still go to the grocery store, you can still go visit your friend. The answer is no. If you are to be isolated, you have to stay at home and stay away from other persons. So even in your household, you should be putting in place that social distancing to ensure that you try to limit the spread even in your household. And Dr. Williams or Dr. Lee can speak to the requirements for persons once they are actually quarantined. That's then a legal requirement that persons have to be will be mandated in order to stay at home.
Quarantine is a legal term. Basically, you are mandated by the medical officer of health to stay home, and whoever go out of the house and break that quarantine is an offense, and there could be a fine or it could be prosecuted.
Mm-hmm. And remember to check trusted sources for information. These include the gov.ky and H.S.A.ky websites, also websites for PAHO and the World Health Organizations, as it is important to not listen to rumored information. Meantime, crews from the Cayman Islands Fire Service and the Department of Environmental Health made good progress overnight at the scene of the fire at the Georgetown landfill. The situation remains dynamic with varying smoke density at the site as crews continue to excavate, damping down, and cap affected areas. Now, early Wednesday morning, waste located close to the landfill boundary flared up during excavation of the site. The decision was then quickly made to close one lane of the H.S.A. highway to allow fire trucks to be strategically deployed and the area to be doused. Now, crews were able to contain the flare-up and reduce the smoke density for motorists' safety quickly. Both lanes of the Easterly Tibbetts Highway, are open and will remain open as long as it is safe for motorists. Well, civil servants and members of the public attended the Honoring Women Month Dress for a Cause photo opportunity here at the Government Administration Building last Friday.
It is Cayman's 21st celebration of Honoring Women's Month, but it comes down, we've adopted it from the United Nations, and it is a way for us to honor women, all of the accomplishments that we have made over the course of history, and really coming down to how far we've come today, but also recognizing that there is still work to be done. It's about how each person in society can contribute to their individual actions, their collective actions really come together to contribute to making each person's experience better in society, and how each person's actions can contribute to improving the lives of women everywhere.
This year's Honoring Women's Month theme is Each for Equal, and it suggests that an equal world is a balanced world, as you'll hear in just a minute. Was reflected, of course, in the equal sign made by supporters. Again, the Family Resource Center is celebrating its 21st year of observing Honoring Women Month. You can check out the Family Resources Center's website or Facebook for details on other activities being held this month. Well, the Health Services Authority is providing free health screenings this Thursday, the 12th of March, from 8 in the morning to 1 in the afternoon. The screenings will take place in the hospital's atrium and will include blood pressure, glucose, cholesterol, height and weight measurements, and urine tests for those that have hypertension and high glucose levels. Now, all members of the public are invited. Celebrated every year on the second Thursday of March, World Kidney Day. Global theme is Kidney Health for Everyone, Everywhere, from prevention to detection and equitable access to care, with the aim to increase awareness of the importance of our kidney health and reduce the impact of kidney disease and its associated problems worldwide. Now, persons with diabetes, hypertension, and a family history of kidney disease have a higher risk of developing chronic kidney disease, or CKD, said Dr. Nelson, the H.S.A.'s internist. However, it is important for everyone to take a vested interest in their kidney health, as CKD affects 1 in 10 persons globally. Now, for a check on other community stories making Radio Cayman headlines this Wednesday, Assistant Professor of Media Studies and Director of UCCI's TV at the University College of the Cayman Islands, Dr. Ivan Eubanks, has been chosen to participate and be a part of a 3-week English language specialist project to take place in Pakistan. The prestigious English language specialist assignment, which is selected by the U.S. Department of State, will help develop the national writing curriculum For universities across Pakistan, Dr. Eubanks will be working in collaboration with the Pakistani Higher Education Commission and faculty from around the country to develop a sequence of 3 academic writing courses that will be required of all college and university students as part of the national curriculum. Well, for these and other Radio Cayman stories, you can go online to radiocayman.gov.ky. Turning now to the forecast from the Cayman Islands National Weather Service, moderate northeasterly winds and moderate to rough seas will continue across the Cayman area for the next 24 hours. It's in association with a high pressure system over the western Atlantic Ocean. Today's high temperature reached 82 degrees, the low 74. The forecast calls for partly cloudy skies with a 20% chance of showers. The winds are from the east to northeast at 10 to 15 knots. Again, seas will be rough with wave heights of 4 to 6 feet today, decreasing to 2 to 4 feet by this evening. For more on local weather, you can go online to weather.gov.ky for the latest there. You can also download their app, which is CINWS. And that ends today's news brief here on CIG Television. If you missed it, we invite you to go to the Cayman Islands Government Facebook page or the CIG Television YouTube channel. I'm Donna Bush, wishing you a safe and, of course, a wonderful night and hoping you'll join us back here again tomorrow. Until then, bye-bye for now.